Well, good morning, everybody. I'm Sarah Morrison, as Jane says, of Public Health Wales, and I am the manager of the programme to embed the whole school approach to emotional and mental well-being. It's great to be part of today's event in person, so thanks to Public Health Network Cymru for arranging this and inviting us to be part of it. In the time that I have this morning, I'd like to tell you a bit about the background of the programme, the principles of embedding a whole school approach, the ways in which we're measuring impact, and the current monitoring data against the national ambitions. So the increased focus on health and well-being has been during a time when schools have faced significant challenges in recovering from the impact of the COVID-19 pandemic and the implementation of education reform. So case study research has shown increased demand for wellbeing services since COVID, with more pupils self-defining with mental health challenges. More students now than pre-pandemic are stating that they dislike school a lot, and fewer are feeling connected to others. We also understand that families are looking to schools more to help address complex issues. So these pressures have underscored the critical role of health and well-being in fostering resilience in the school community, as well as supporting academic achievement. The focus on a whole school approach is based on evidence that interventions are far more likely to bring about change when they're applied across the whole school. So while single interventions might have a positive short-term impact, whole school approaches can have a far longer term positive effect. In their global initiative to make every school a health promoting school, the World Health Organization and UNESCO summarized the evidence that no education system is effective unless it promotes the health and well-being of students, staff, and community. It's known that health, well-being, and educational outcomes are intertwined, and by looking after one, we make a positive impact on another. So a health-promoting school is defined as a school that's constantly strengthening its capacity as a healthy setting for living, learning, and working. It uses its organisational potential to foster the physical, social, emotional, and psychological conditions for health and well-being and positive educational outcomes. So it fosters health and well-being with all the measures at its disposal. It engages everybody in its efforts to make a school a healthy place, including health and education services, teachers, students, parents, third sector, and community leaders. It strives to provide a healthy environment for the children and young people and improve the health of the wider school community, including staff and families, helping them to understand how they can contribute to the health and education of the school and also how they can undermine it. A health promoting school also implements policies and practices that respects an individual's well-being and dignity and provide multiple opportunities for success. So we've got our own version now in Wales. So we've developed in Public Health Wales a proposed set of new national standards for health and well-being promoting schools that embody these WHO and UNESCO principles. So we're currently engaging with schools and the wider system around these standards, asking for feedback, and recommendations will be made to Welsh Government in the summer based on that feedback. So if you haven't done so already, can I just take my chance to encourage you to engage with this, and I'll ask Public Health Network Cymru if we can circulate the link to the document after today. There's a feedback deadline of the 11th of April, last day of term for most of us, but if that doesn't fit your timeline, just keep talking to us throughout April and May, and we'll make sure your feedback's incorporated. So the standards have been designed as an alternative to the National Quality Award to make it easier for schools to focus on the core principles of a whole school approach that supports a range of health and well-being outcomes, including emotional and mental well-being. They're described as the 7 core components, which include strong leadership committed to health and well-being, understanding learner needs to inform priorities and action, involving and engaging the whole school community, a workforce supporting their own well-being as well as that of their learners, a curriculum working hand in hand with the wider practices, a positive school culture and environment that reinforces the school's commitment to health, well-being and learning, and strong partnerships that enable schools to access the help and support they need once they've identified that need. And here they are again in Welsh. So the proposed standards align directly with the whole school approach to emotional and mental well-being, and they build on the process, or the learning from the process of implementing the whole of school approach to emotional and mental well-being. So we're heading now for an integration of the whole school approach to emotional and mental well-being with these standards, which will be delivered through the Welsh network of health and well-being promoting schools. So many acronyms, I'm sorry about that, but the essential message is, at the moment, this is a standalone programme. Has been for 3 years and will continue to be for another year, but there's an integration process that will bring it together with the WNHWPS. So the whole school approach to emotional and mental wellbeing framework was published in March 2021 by Welsh Government as statutory guidance. It was published for governing bodies of all schools and local authorities, and it aimed to provide direction and a template for education settings to use. It requires the whole school community to self-evaluate the culture of their own emotional and mental well-being landscape, identifying strengths and areas for improvement that are unique to them. So the framework encourages the creation of a school well-being ethos based on 3 core values of belonging, efficacy, and voice. It also requires schools to work alongside others and recognise when to seek help when emotional and mental well-being needs are identified. So harking back to that WHO definition of a school that is constantly strengthening its capacity, it's a continuous process of reflection and improvement that should enable the school to embed ways of working that protect and promote the emotional and mental well-being of the whole school community. The framework, the Welsh Government's framework, outlines an approach to an inclusive dialogue that schools should take to help them identify what they're doing well and what they need to get better at. It's intended that schools will draw on multiple sources of evidence, and then having identified areas for improvement, these should be prioritised in an action plan that can be incorporated into wider school development plans. So there's that theme of embedding a whole school approach to emotional and mental well-being, not having it as a standalone activity. Schools are expected to review the effectiveness of the measures they take and for it to become a continuous process aligned to their existing school performance arrangements. So that's summarised here. Sorry, it's a bit small, but I think it's familiar as a continuous improvement approach. It's what the school's senior leadership team follows in implementing the approach. And on behalf of Welsh Government, Public Health Wales developed a self-evaluation tool to support schools in step 1, the scoping process. Welsh Government has provided this funding over 3 years, and that's been largely to employ a network of implementation coordinators So they coordinate support to schools to complete their self-evaluation and address their needs in an action plan to develop and deliver their whole school approach. The process takes time and space and tolerance of some feeling of risk, I think it's fair to say, but the intention of a continuous improvement approach is that small changes create confidence to go further on the journey towards a whole school approach until all decisions, every action and decision is considered in the light of the well-being of all. It's not meant to be overburdensome, but it is intended to provide some consistency across Wales, building on the requirements of the new curriculum. Welsh Government did a survey of school leaders year before last, and they found that the use of the self-evaluation tool was high, although more frequently used in secondary schools than primary schools. So consequently, Welsh Government broadened the ambitions they attached to the programme funding in this last year to include a more explicit focus to include primary schools as well. So, measurement, yeah. So a process evaluations around implementing this whole school approach have been completed, and if you'd like to know more, then there are learning reports on the whole school approach to emotional and mental wellbeing website, Public Health Wales's website. They've set out to understand how schools have been embedding it, including a thematic analysis based on surveys and interviews with the workforce supporting schools as well as schools themselves. They've included case studies to describe, explain, explore the process, and they've been gathered from a wide range of sources to really try and pinpoint, drill down what works, why, for whom, and in what circumstances. So we have some valuable learning there. Our aim is to help facilitate the transfer of knowledge and evidence to enable more effective practice. So please share it. There's also an independent evaluation underway, which is a 3-year mixed methods evaluation being carried out by Decipher, which you might know is part of Cardiff University. That includes interviews with children, young people, staff and professionals working within education to gain insight into how schools have made use of the framework in developing their strategies, policies. And we're also looking at the data gathered by Shern to see whether there are any changes in the way that learners describe their own mental well-being. So by considering all of these things together, we will arrive, hopefully, at a picture about whether school developments might explain any changes in learners' emotional and mental well-being. School cultures that prioritise well-being were found to be very important, and some of the ways in which school culture has been embedded is shown in this diagram. Priority is given to building relationships between everybody in the school community and fostering a connected school community. There's a big emphasis on connectedness in the Welsh Government narrative at the moment. Sharing values and beliefs, promoting pupil compassion and mutual respect, and leadership by a supportive senior team. This poster was produced by Decipher as part of the independent evaluation of the whole school approach, and they asked teachers about well-being in schools and how needs have changed since COVID. They interviewed 36 primary and secondary school staff and found that while most pupils were doing well, there were some clear challenges, extra challenges since COVID. So key points from primary school teachers in particular were that they'd seen an increase in developmental issues in some of their younger learners. They discussed an increase in learners who are finding it more difficult to work and communicate in groups. More learners were describing themselves as experiencing anxiety at school. more were experiencing challenges in emotional regulation and sensory overload. Some schools were creating safe or quiet spaces for children, although this was often a challenge because of the lack of resources, so whether that was funding or space wasn't possible for everybody. And some staff were concerned about not having the training or the time to deal with some of the more complex mental health issues that they were seeing. Oh. Okay, that's not quite the slide I was expecting, but it's got the data on it. That's absolutely fine. So the broader focus on including primary schools gave rise to an ambition from Welsh Government for the programme this year that 80% of all schools should be action planning by the end of March, by next Monday. So we've reached that. So that's the bottom left figure up there. 81% are action planning. That's good. That's great. The other ambition for this year was that 100% of secondary schools should be action planning. You can see that we've got to 97%. It can be difficult to achieve 100% of anything, but 97% is great, and huge recognition for the workforce that has worked with schools to make that happen. Now, these are the definitions we've been working with this year to monitor. We've got a measure to onboard schools. Are they aware of it? Has initial conversation happened? Self-evaluating, have they begun looking at their practice and identifying their areas of improvement? Bless you. And have they actually started action planning? So that's what we've been using this year. So this is the last of a 3-year programme. Okay, this is the last of a 3-year programme for implementation. That phase is done now, and we've not long been told that Welsh Government will give us 1 further year of funding for 25-26. And the ambition for this coming year is that all schools will have an action plan. So I think there's a slight shift in emphasis there, that it's been activity focused for the last 3 years. This is more tangible now. For 25-26, all schools, whether they're primary, secondary, middle, PRUs, special schools, will have an action plan for emotional and mental well-being. As I say, we're going for this integration of the 2 programmes, and I can just finish, if you don't mind, but just by repeating about this engagement exercise around the proposed new standards. And if you can, let us have our views. It will help so much to make it as strong and as useful as possible. So thank you for listening to me today. And if you want to follow up with the Public Health Wales team in any way, at any time, you're most welcome to email me on that email address. Okay, thank you. Thank you.